Well, welcome back. My name is Dr. Jerry O'Neill. I'm an internal medicine specialist, and I'm sponsored by Dallas Live Tonight. We're bringing you a few minutes of medicine, things that can possibly help you maintain your health, know when to go to the doctor, and know what to tell the doctor when you get there. Some of the things we'll talk about may also be things your doctor recommends that you do at home. Today's program is an expansion of our original program on vital signs. Because of requests, we've been asked to explain blood pressure and its measurements a bit more. Now, we've already gone over what blood pressure is. Blood pressure is generated by the force of your heartbeat and the resistance of your arterial bed. That is, it's like a garden hose. The hose turns on, it pushes the water into the hose, but the pressure in the hose is actually determined as much by the force of the water coming out as it is the resistance of the hose. Blood pressure is called a measurement of the heartbeat, systolic, or the residual pressure in the system, diastolic. These are recorded as the higher number over the lower number. Now, how do you measure your blood pressure at home? Generally, or until recently, almost all blood pressure measurement was done with some sort of cuff, such as this. These were placed on the arm above the elbow, like so, and the leads were attached to various measuring devices. In years past, we used mercury manometers. These lines or tubes from the cuff were attached, an inflation device was used, and the mercury rose in a column until you surpassed what blood flow there was in your arm, and that is you constricted all the blood flow, and then you let the pressure off, presumably slowly. The pressure dropped, and the first time you could detect a pulse, that was the systolic blood pressure. That's the pressure of the beat of your heart. You would continue to hear that bump, bump, bump until it got to a lower number, and then it would stop being audible. That's the residual pressure in the system. So in this case, I've pointed to 190/70. Now that's not a normal blood pressure. I'm merely trying to demonstrate the device. You don't have to worry about this much because mercury manometers are no longer manufactured. In many instances, the same technique is used using an inflatable cuff, but it's attached to what's called an aneroid. This is a gauge that responds by spring pressure to pressure in its system. You can see that the needle moves up and down depending on how it's inflated. These generally are accurate if used properly, but they can get out of whack, no question about it. The more popular method currently used in most doctors' offices and dentist office are a wrist-mounted electronic device. Straps on the wrist, powered by a couple of batteries. You hit the power button, it starts, it makes a pressure you can feel, then it lets the pressure off, and again, like the manometer or the aneroid, it'll give you a top number and a bottom number. That's the systolic and diastolic blood pressure. Most of these devices also will give you a pulse rate. They can be had for anywhere from $25 to $50 depending on where you buy them. In general, they are a little, let me go back. They're not as user-friendly as some devices, but in general, once you learn where to position your arm and that your pressure should be taken at the level of the heart, most of these devices give pretty good readings. In the future, I'm expecting there to be cuffless blood pressure monitors. These will be in the form of a watch. much like the smartwatches produced by several electronic manufacturers these days. They will use an entirely different method. Instead of constricting the artery and then releasing the pressure, they will work by measuring the amplitude or how high the pulse rate moves up and down, and a number of other methods. Right now, there are none available in the United States. I understand they're being manufactured and sold in Europe. There are some questions about the accuracy of these devices, so it'll be a while before we see them, but they're on their way. It's important that you measure your blood pressure at the same time each day. You don't want to measure your blood pressure when you've come in from running, when you've exercised, when you've been out in the heat, when you've been skiing, or when you've been frightened or anxious, period. You need to measure them at rest and the same time at each day. Many people think the best time to measure blood pressure is when you get up in the morning. Some people think it's at the evening. Some people think it's midday. It doesn't really matter, but I would do it the same time each day. And depending on what you're going to do with the information, and especially if it's requested by your physician, you should probably write it down and keep a record. Blood pressure can be very important, especially for those who have cardiac problems or who have blood pressure problems per se. I hope this has been helpful to you. It certainly has been a pleasure for me. My name is Dr. Jerry O'Neill. Thank you for tuning in.